for having me. I'm really excited to be able to talk about prevention and some of the work that we're doing to prevent child sexual abuse. So as I was introduced, my name is Ryan Shields. My preferred pronouns are he, him, his. And I'm actually currently an assistant professor at the University of Massachusetts Lowell in the School of Criminology and Justice Studies. And I was the former associate director of the Moore Center for the Prevention of Child Sexual Abuse at Johns Hopkins University. And a lot of the work that I'm talking about today is also with my colleagues at the Moore Center. Okay, so just to give a quick outline about the talk, I'm going to start with talking about the scope of youth who engage in harmful sexual behavior to get a sense of how big the problem is. And then I'll discuss the dominant response that we have to this kind of behavior, which is a criminal justice response. After that, I will go into a pitch for why I think a public health approach to responding to child sexual abuse is sort of the direction that we need to take. And then I'll end with a discussion of a unique project that I'm currently working on called Help Wanted, which is building an online prevention intervention for adolescents who have a sexual interest in children. So a unique problem and a novel way to go about approaching that problem. And then finally, I will conclude with a discussion of potential next steps that we all can take in our professional work towards the prevention of child sexual abuse. So the first thing that I wanted to do was to start with a poll. So my question to the audience is, how many of you consider yourself to be, in your professional role, a sexual violence preventionist?
Awesome, so the answers are starting to come in. I'm just gonna wait a couple more seconds for a couple more answers. Awesome. So I think we're going to stop here for collecting and I'll show it to everybody.
Yeah.
There you go. So it looks like we have yes, 10 people responded yes. They do consider themselves to be a preventionist. And then one person said a maybe.
Okay. So excellent. And so my hope is that no matter who we are in our professional roles, that by the end of this talk, we all can sort of see our personal stake in becoming a sexual violence preventionist and in the work that we do and the conversations that we have. I see everyone as a potential preventionist. So thank you for participating in that poll. Okay, just to start off on some a note about language, I think it's important to think about the ways that we talk about things. And so throughout my talk, I will refrain from using the term juvenile sex offender. This is common within criminal justice literature, the criminal justice system, but the juvenile sex offender label can be potentially damaging. And so what Kelly Socha and Andy Harris, who are also at UMass Lowell, what they found was that by using this label, it sort of endorsed notions of youth's propensity to re-offend as adults, sort of like that inevitability of offending, and also impacted public support for sort of harsh punitive policies regarding youth. And so what my preference is to use alternatives. And so the alternatives that we can use is child with sexual behavior problems, child who's engaged in harmful or illegal sexual behavior, minor youth who's committed crimes of a sexual nature. It sounds wordier than juvenile sex offender, but we know that that label can be harmful. So I think it's important for us to think about the ways that we describe some of these things. So I just wanted to make that note. The one clarification is what I do use the term juvenile sex offender when I'm talking about the policies that are named as such. For example, juvenile sex offender registration and notification, because they're named as such. Okay, so a little bit of background on child sexual abuse. We know that child sexual abuse is a serious but preventable public health problem. Right? The World Health Organization has classified child sexual abuse as one of the leading preventable risk factors that contributes to the global burden of disease. The important word there, though, is it's preventable. It's a preventable public health problem, but our dominant responses to child sexual abuse really fall along reactive responses rather than a prevention response, which I think is something that we need to critique. In terms of the scope, the conservative estimates is that 15% of girls and 5% of boys will experience child sexual abuse, but other estimates are larger, roughly 1 in 4 girls, 1 in 5 girls, and I've seen 7 to 10% of boys. the scope of the problem is such that, you know, it impacts a lot of people. The potential consequences, though, are also significant. So we know that child sexual abuse is associated with a host of potential short-term and long-term negative problems for people who've experienced child sexual abuse. So we know that people who've experienced child sexual abuse have increased risk for behavioral, mental, and physical health problems. We also know that experiencing child sexual abuse increases your risk of experiencing sexual violence again. And so the consequences associated with these experiences are significant. The one statistic that whenever I talk to people about child sexual abuse that seems surprising is that approximately a third to half of all cases of child sexual abuse involve other youth, right? So other kids commit child sexual abuse against 30 to 50% of the cases involved. This is always, I get like a surprised look when I mention this statistic. I don't think this is well known. So then when I say that youth contribute 30 to 50% of all cases of child sexual abuse perpetration, the inevitable question is why? Why do kids engage in harmful sexual behavior? And the implication or the assumption is that there's sort of one answer, like there's one pathway, when in reality there's multiple pathways, and there's lots of reasons why. So here, just looking at slide 6, I've listed some reasons why youth engage in harmful sexual behavior, right? So we have children who are reacting to their own trauma or abuse. We have sexual violence, problem sexual behavior as a form of sort of persistent delinquency or a form of aggression or violence. We see kids engaging in these behaviors in an experimental but irresponsible fashion. It may be a function of immaturity, impulsivity, right? Youth imitating what they see in the media or misinterpreting cues. And on the next slide, it goes on. And the whole purpose of this list is to show that there's really no one pathway to engaging in harmful sexual behavior, right? There's lots of reasons why. And a lot of these seem to be situational as well, right? Things that are related to the situation or the opportunity rather to some inner trait, right? So in this list, we have ignorance of the law, harmful sexual behavior as a rule violation or as a function of mental health problems or peer pressure. Again, there's a variety of reasons. There is promise, though, in terms of youth who engage in problem sexual behavior. These are not lost cases, okay? These are not lost cases. And so the assumption, I think, in the general public is that, quote, once a sex offender, always a sex offender. And the research really doesn't bear that out. So Michael Caldwell has done a series of studies looking at recidivism, and the word recidivism means reoffending. So engaging in illegal sexual behavior after they've already been caught, right? So they've been identified by the system once, and then recidivism would be being arrested or charged after that. And what Caldwell found was about 97% of youth who have been previously caught or previously identified by the system will not reoffend with a new sexual offense. 97%. And the other important statistic I think that's important to note is that recidivism rates, so rates of reoffending, have been declining over time. So they're lower today than what they once were in the 80s and the 90s. That's also promising as well. When youth who have been adjudicated with a sexual offense do reoffend, it's much more likely that they reoffend with a non-sex offense. So a new property offense or some other offense, but not a new sexual offense, right? I think it's also important to note that while this is what's known to police, right? This is what gets identified, and we know that sexual victimization is underreported. So we have to recognize that these are conservative estimates, but also that these kids are the kids that are being monitored the most, right? And so I think it's important to think about how we've responded to child sexual abuse historically and how we're responding to it today. Typically, what we see is a response to child sexual abuse as a criminal justice problem and a criminal justice solution, right? This is a social problem that involves justice systems to respond. And I think that it's important for us to critique that position. The other thing, this is just a side note, I had these two images included on the slide. When you Google sexual violence or sexual abuse prevention, there are certainly images that come up. And I'm actually this summer engaging in a study that evaluates the quality of graphics used in child sexual abuse prevention materials, and to determine whether those graphics actually promote a prevention message. That's just an aside, but I wanted to say, the reason why I bring up those two images, because I don't know how good of a job they're doing at promoting a prevention message, but this summer I'll be doing a study that evaluates that.
Thank you, Ryan. And we have a quick question from the audience.
Sure.
What age range do you identify as youth?
So youth is typically under the age of 18, so 17 and younger. There's been a lot of recent work around emerging adults. So that's the 18 to 25. And how adults are the emerging adults. But typically when I say youth, it's 17 and younger.
Awesome.
And typically 12 to 17, because a lot of times under 12 doesn't.
Okay, awesome, thank you.
Thank you. Thanks for that question, that's a great question. Okay, so now discussing this criminal justice solution kind of approach, I wanted to be clear that there are achievements under this approach, right? Looking at child sexual abuse and sexual violence more broadly as a social problem with criminal justice solution, there have been achievements under this style of approach. So what do we see? We see the development of safety nets for women and children who are experiencing sexual violence. We see an increased awareness among public and policymakers. We see people more likely, more willing to talk about sexual violence. Certainly there's gains to be made, that's quite clear. But in terms of where we were, we're seeing increase in awareness and increasing willingness to discuss these things. We've also seen the development of evidence-based therapy for people who've experienced child sexual abuse. So those are really important wins. And then in terms of criminal justice solutions, there have been some gains here as well, right? So the clear demarcation that adult sex with children is illegal, right? So if we think of the criminal justice system as a sort of outward-facing message, the fact that this is illegal is clear. We've seen increased consequences for people engaging in sexual violence over the past 20 to 30 years. We've seen advances in risk assessment for people who perpetrate sexual violence, advances in offender treatment, and also reintegration efforts too. So there have been some wins associated with this criminal justice kind of perspective in terms of addressing child sexual abuse. But I think the flaw is that it's reactive. We have to still wait for harm to occur in order to then respond to it. Like that's the flaw inherent in the logic of a criminal justice-based solution to child sexual abuse, that we have to wait for harm to occur. And I think we can do better than that. We've also seen the development of some child sexual abuse preventions, and a lot of this is focused on victimization prevention. So teaching potential victims to recognize potentially abusive situations, to resist abusive overtures, or to report previous or ongoing abuse or potential abuse. So if we think about that though, the assumption is that youth, children, under this sort of perspective, are responsible for protecting themselves, right? That they're responsible to recognize, resist, and report. No, that's not how it works, right? Adults are responsible. Children aren't responsible for their own safety, adults are. And so I think we need to kind of critique that approach. The research indicates that this style of prevention does increase knowledge about child sexual abuse concepts, prevention concepts. It does encourage disclosure. People are aware of things, and so they are more likely to report. And it does reduce self-blame following victimization, which all of these things are important. But in general, the science has not shown these approaches to actually reduce victimization rates. So actual experiences of victimization. So it increases knowledge and increases skills in recognizing and reporting, but really hasn't resulted in clear declines in victimization. So again, under this approach, what we have is a reactive style in addressing child sexual abuse. We wait for harm to occur, and then we give victims services, and then we punish offenders and then give offenders treatment services at the end of those punishments. And again, all of these are reactive, right? In terms of the offender perpetrator of sexual violence perspective, these are primarily in the form of punitive policies. So over the past 20 to 30 years, we've seen increased odds of incarceration, so people are more likely to go to prison, and when they do, they go to prison for longer periods of time, on average. We've also seen the development of civil sanctions. So we see registration notification, which is where people who are convicted of a sex crime are put on a registry. They have to register twice a year, 3 times a year, quarterly, with their law enforcement agency, give information about where they work. And in some states, this information is public on an online website. We've also seen the development of residence restrictions. Residence restrictions restrict where people who are adjudicated or convicted of a sex offense are allowed to live. They're not allowed to live within a certain number of feet from a park, playground, school, any place where children congregate. We've also seen civil commitment, where at the end of the term of incarceration, there's an evaluation to determine whether that person should be released into the community or into a civil commitment facility for treatment until they're rehabilitated. The problem with these styles of approaches is that they don't match what we know about sexual violence and sex offending. So we know that there's generally a low base rate of recidivism. It's very low for youth, 3% or so. And even for adults, it's a lower than average or lower than expected rate of reoffending. It's also a focus on identified offenders. So it's important to realize that in a given year, 90 to 95% of the cases of sexual violence are involving quote unquote new perpetrators, people who have not yet been identified by the criminal justice system. So even if we were to focus on preventing every case of recidivistic sexual violence, so sexual violence perpetrated by someone we know about, the lion's share is perpetrated by people who we haven't yet identified. And the other part of this is that this logic is really focused on stranger danger, right? That's the message that we send with these kind of policies. We need to protect children from strangers. And certainly strangers do engage in sexual violence, but 95% of cases of sexual abuse, of child sexual abuse, involve someone already known to the victim, someone in the victim's life, right? Coaches, cousins, family members, peers. It's people that are already involved in the youth's life. And so the focus on stranger danger, again, I think is somewhat misplaced, right? Given what we know about sexual violence. And the other part that we need to critique about this criminal justice response to sex offending is what we do with youth who engage in problem sexual behavior. And so in the development of registration notification policies and residence restrictions, youth were neither specifically included or excluded. And so what happened is states were sort of free to decide what they wanted to do with youth who engage in these behaviors. And what we saw was that many states decided to apply their adult punishment schemes to youth who engage in problem sexual behavior. And so most notably, we have put youth on sex offender registries and subjected them to public notification. Here's the problem with that style. Once again, it doesn't comport to what we know about youth who engage in problem sexual behavior. When these policies were enacted, and the director of the SMART office then said that, well, the worst of the worst were being required to register, only the worst of the worst. And research from Michael Caldwell and others found that actually no, roughly 60 to 75%, based on the law, 60 to 75% of youth who've been adjudicated with a sex offense would be applied to registration notification policies. Youth who are overwhelmingly low risk, right? There's also been several studies that have looked at the impact of registration notification of youth on preventing recidivism. Again, that's preventing reoffending. So Elizabeth Letourneau did a study out of using some South Carolina data and found no effect of juvenile sex offender registration notification policies on the rate of sexual or violent recidivism. What it does do, though, is increase the risk of nonviolent charges. These are charges, but not necessarily adjudications, which suggests a surveillance effect, that these kids are just being watched and being caught for things that they normally would not have been caught for. Again, these are nonviolent charges. So that's in terms of how juvenile sex offender registration notification theoretically would impact community safety. It would either be through reducing recidivism or reducing first-time offending. So research hasn't shown any effect on reducing recidivism. In terms of reducing first-time offending, we find the same results, that states who have adopted the juvenile sex offender registration notification policies have not seen a subsequent reduction in rates of first-time sex crimes, right? Which again makes sense if we think about what we know about youth, right? So for this policy to have an effect, a kid would have to first recognize that their behavior is illegal sexual behavior. They would have to think that they would potentially be able to get caught if they did it. If they get caught, that they would be punished. If they were punished, that would be followed with these civil sanctions. So this thought process, anyone who's ever met a kid probably would suggest that this is not the way that kids think, right? And we also see that juvenile sex offender registration policies impacts the way we process these cases, that prosecutors are less likely to pursue these cases as sex offenses, right? That they're more likely to plea bargain, more likely to plea out of a sex offense. And the consequence there, of course, is from the survivor perspective and legitimacy of the criminal justice system if their cases aren't being processed in the way that they think they should be, right? There's also been research that shows that sex offender registration notification for youth is harmful. So Nicole Pittman has done a series of interviews with youth who are registered and found increases in suicide ideation and harassment and disruption, family disruption. So at the Moore Center, Elizabeth Letourneau, Andy Harris from UMass Lowell, and myself and some other colleagues wanted to see sort of broadly across the country, did we see those kinds of things? And so we did a survey of youth who are currently in treatment for problem sexual behavior. And we had youth who were required to register and those who were not required to register. And what we found was that youth who were required to register, their odds of a suicide attempt within the past 30 days was 4 times larger. So they're more likely to attempt suicide within the past 30 days. Additionally, youth who were required to register, their odds of being contacted by an adult for sex were 5 times higher than youth who weren't required to register. So the very thing that we're trying to prevent, child sexual abuse, seems to be higher among youth who are registered, right? And so I think these findings really sort of have to make us sort of take a step back and think about, is this the approach that we should be taking for youth who engage in problem sexual behavior? I would suggest not. So this is a question to the audience, and feel free to write in the chat box. But my question is, in light of this evidence, why do we continue with sex offender registration notification, or even if you want to think more broadly in terms of the criminal justice response, why do we continue with this as a dominant response?
Yeah, and so if folks can please put it in the chat box, the answers that they might have. Even if you're unsure, you can definitely write that as well. And so we're getting some messages.
Okay.
Public perceives themselves as safer with the registration. Another person says fear. Because it is what's more commonly known as an option. That's very true as well.
Yeah, I think that's a fantastic point, is what we know, it's concrete. like it's a concrete thing that we can have. And sometimes when we talk about prevention, that's preventing something from happening. So what's the image that we use? Like what's the representation of something that doesn't happen? Whereas a criminal justice response is a more concrete response. That's a really good point.
Yeah. And we have one more answer that came through. Could be the path of less resistance. Oftentimes it involves adultism. No one really wants to think about youth.
Yeah. And also I think no one wants to think about like the kids in their life. Like for example, when we talk about child sexual abuse prevention, right? We want to keep kids safe, right? We want to keep kids safe from experiencing sexual violence. We need to extend that and say we also want to keep kids safe from engaging in sexually violent behavior. And I think sometimes we think about the kids in our own life sort of as potential victims, but not as potential people who engage in problem sexual behavior. And that's harder. That's a harder thing to wrap your head around. Yeah. Excellent. Well, thank you very much for those responses. I appreciate that. So now I'm going to move on to a pitch for the public health approach to child sexual abuse and why I see this as a promising way for the future. So the public health approach to prevention, just in general, is a series of steps that has been shown to be effective in various forms of violence prevention. So this has been used in dating violence and in bullying. We see this used in outside of violence, but also in terms of injury, the injury research. So traffic, car crashes, drinking and driving. We see the public health approach to prevention, whether it's violence prevention or injury prevention, used in a variety of contexts. And so there's no reason why it couldn't be applied to child sexual abuse, right? And so what is the public health approach? Well, it's a series of steps: surveillance, risk factor identification, intervention, evaluation, and implementation. So I'll walk through what those look like. In surveillance, essentially, this is identifying the scope of the problem. How many people experience child sexual abuse, right? Who does it affect? How does it affect different groups differently, right? How does it change historically? What's the epidemiology of the problem, right? It's getting the sense of how big the problem is. For some offenses, we're pretty good about identifying the scope. And then for other issues, we're not. I can think of trying to answer the question of around commercial sexual exploitation of children, so domestic minor sex trafficking. How many kids experience this in a year? And the reality is we do not have good science to even answer that question. So this is the first step, and it's such an important step to identify what the problem is and how many people it affects and how it affects them. That's surveillance. So once you get a sense of how big the problem is and who it affects, you can start to think about identifying potential risk factors, right? So what is the cause? What are the things that increase the risk of this happening? Relatedly, you also identify the protective factors, those things that decrease the risk of these experiences. So what are the risk factors? That's the next step, identifying those. And I'll move back to that slide, but to get a sense of how we should be thinking about risk factors, the social ecological model, I think, is a useful tool. So people do not exist in vacuums, right? So people exist in context within relationships and within communities and within societies. And so risk can occur at any one of those levels. And a lot of times when we talk about prevention, we focus on the individual risk. So we talk about risk factors such as history of trauma, personality, mental health, behavior, something unique to the individual. And sometimes that's where the conversation stops. But that person doesn't just exist on their own. They're situated within context, right? So they're situated within relationships, family dynamics, peer networks, right? Those relationships are then situated within communities, whether that's a school community, neighborhood community, church community. And then we have communities situated within society. And so larger society values, right? And also larger issues that are found in society around misogyny and patriarchy, right? So when we talk about risk factors, a fully comprehensive approach would target risk factors at each of those levels, at the individual level, at the relationship level, at the community level, and within society. Where we are right now in the science is really around individuals and relationships, although there's been some important work happening at the community level too. Okay, so back to the public health approach to child sexual abuse prevention. So that's risk factor identification, identifying those things that increase the risk of child sexual abuse to occur. Then the next step, the third step, is to build programs that identify or that target those risk factors by either reducing the risk factor or by promoting those protective factors. And once those programs are built, the important step is the evaluation, identifying what works. How does it work? How is the way that you should administer the program, right? Does it achieve the objectives that you thought it would, right? Intense evaluation to figure out, does this work? And then also, how does this work? And then the final step in the public health approach to child sexual abuse is dissemination, right? To disseminate those programs where we have an evidence base that shows that they're effective, right? And for those programs that aren't effective, either diving into what went wrong or redirecting our efforts. So this is very much a problem first, then response style, right? Identify the problem, identify the nuances of the problem, and then develop a response that identifies those things that you targeted in your problem identification. So problem first, then response. But if you think about our criminal justice response, a lot of what we have is response without fully understanding the problem. And therefore, the response that we've built through sort of like a focus on punishment, right, misses the boat because it doesn't actually target those risk factors that increase the chances of this happening. So again, the public health approach to child sexual abuse is a promising style of identifying the problem, fully understanding the problem, and developing programs that seek to take that problem apart. So what does prevention look like? I just thought I would briefly talk about some things that are currently being utilized in the field before going into my own project. And so in terms of primary prevention is preventing something before it happens in the first place. Primary prevention is typically the outcome of universal prevention programs. And universal prevention programs means targeted to everyone, right? You go into a school and everybody gets the intervention. And examples there are shifting boundaries and safe dates, and I'll go into more explanation in just a moment. Outside of primary prevention, we also have secondary and tertiary prevention. So these are more targeted prevention efforts where we target youth who are either at risk of engaging in the behavior or youth who are already engaging in the behavior and we're trying to stop it from happening again. And so I have two examples, the Oklahoma model and multi-systemic therapy, which I'll discuss in a moment as well. So prevention takes many forms. And I think it's important to recognize how, whether your work is in primary prevention or secondary or tertiary, how they all sort of fit together towards a larger prevention goal. So as an example of primary prevention targeting young teens, we have Shifting Boundaries and Safe Dates. Shifting Boundaries is a program it's a school-based program for middle schoolers, and it teaches them essentially information about personal boundaries, about personal space, their own and respecting other people. It also takes an environmental approach. So it has kids map in their schools and classrooms the areas that are unsafe, the areas that promote sort of boundaries being crossed. And so, for example, a lot of bullying takes place in hallways or stairwells during class switches. Or in bathrooms, right? And so by doing the environmental design, it identifies those areas where bullying behaviors and boundary crossing are taking place, and then schools can redirect flow from classrooms. They can have staff in areas that previously staff weren't located in. So it's an attempt to really teach kids about how to respect their own boundaries and others as well. And then you have Safe Dates. Safe Dates is for teens. So I think typically middle school and high school, and essentially it teaches them about healthy relationships, about dating violence. They take place in developing posters, and they are involved in putting on like a demonstration, a play, all around unhealthy relationship behaviors and sexual violence prevention. Now, the critique of safe dates that I think is important to recognize is that a lot of these programs, I think this is a critique that we can apply to the field in general, a lot of these programs are built without the input from people of color, and especially queer people of color. Right? And so when communities are excluded from the building of the programs, we know that that increases the likelihood that those programs then won't be responsive to these communities. And I think as we talk about prevention and as we think about how do we improve our efforts and redirect our efforts, we really need to have a discussion and a conversation around inclusion, right, and diversity of voices to make sure that we are reaching broader communities. So I just wanted to mention that caveat. Both shifting dates, both shifting boundaries and safe dates have evidence base to show that they are effective in preventing sexual violence and in developing healthy relationships. And so they're listed on OJJBP's website of things that work. And then in terms of our secondary and tertiary prevention, again, this is targeting youth who are at risk for engaging in problem sexual behavior or youth who have already engaged in problem sexual behavior. There are promising evidence-based treatments. So cognitive behavior therapy for problem sexual behavior is one of those evidence-based programs. And it's rather than, compared to, I think the comparison there was with play therapy. So in comparison to play therapy, this sort of group family-focused style of treatment was more effective in preventing future sexual offenses among these youth. So they looked more like kids who didn't have a history of problem sexual behavior. We've seen that CBT for problem sexual behavior has also been extended to older teens, so 13 and 14, and those added components, again, since the kids are older, you start having more developmentally appropriate materials, and so there were components that addressed sex crime laws and monitoring sexual situations, juvenile justice issues, communication with parents, sex ed that was developmentally appropriate, and again, it's family individual sessions and case management, and also similar for younger kids, for the 13 and 14-year-olds, there were also large effects in reducing problem sexual behavior, most notably in lower rates of reoffending and reduction in trauma symptoms as well. And then for youth who have serious problem sexual behavior, multi-systemic therapy for problem sexual behavior has been shown to be effective in reducing sexual risk, delinquency, and sexual abuse. So multi-systemic therapy is really around, it's an intensive family-based, family-focused treatment approach that involves actors from several different systems, right? So you have people within the family and treatment services, and also schools and communities to develop action plans for youth who engage in problem sexual behavior. And some randomized controlled trials that were conducted by Elizabeth Letourneau and colleagues have found that youth who were treated with multi-systemic therapy for problem sexual behavior had lower rates of sexual risk and delinquency. So I wanted to spend some time talking about a project that myself and some colleagues are working on for adolescents with a sexual interest in children. The reason I want to focus on this is because this population is somewhat unique. So these are individuals, adolescents, so under the age of 18, who are recognizing a sexual attraction to children. Sometimes they call themselves non-offending pedophiles or minor attracted persons. I don't use those labels myself because I'm not sure that everyone who experiences a sexual interest in children identifies themselves as one of these two groups. And so my focus is on just the behavior or the attraction rather than the label. But it's a group of people that we often don't talk about and that are in need of some help. And so I thought I could spend the rest of the talk going over this project. So why do we focus prevention efforts on kids? Again, just based on the discussion that we've been having today, we have excellent evidence that we can prevent delinquent behavior, right? Adolescents contribute a large proportion of cases of all child sexual abuse cases. And so it's an important part of our prevention efforts. I gave the list of why kids engage in problem sexual behavior. And in some of these cases, not many, but in some, adolescents might actually be motivated by a sexual attraction to children, right? So some emerging evidence suggests that anywhere from maybe 3 to 5% of men are sexually attracted to prepubescent children. And that attraction typically emerges in adolescence. And what we've heard from anecdotes is that when these individuals try and seek help, they often can't find any, right? So before we jump into the details of that project, I just want to get us thinking about maybe some of the barriers. So what do you think some of the barriers are to finding help that adolescents who have a sexual attraction to children might face? What do you think some of the barriers to getting help for this population might be? And this is one of the chat box entries.
Awesome, thank you. Oh, and so we have a couple answers. We have language as one of them. Shame to acknowledge this attraction, very embarrassing, they feel judged, stigma and shame, being labeled as a perpetrator and or pedophile.
Yeah. Those are excellent responses, and we're actually going to touch on all of them. The one that I wanted to address just now is around the language. Mm-hmm. And this is just really important because oftentimes the language that we use in prevention materials, in articles about sexual violence, has a stigmatizing effect. And so, for example, there is a program in Germany called Dunkelfeld, Prevention Project Dunkelfeld, which links services to people who have a sexual attraction to children. They call a number and they get directed to services for free. And so in talking with some of our participants, which I'll get into, they mentioned that campaign, which is really great, that they're trying to connect people to services, the images that they use and the language that they use makes the people feel bad about themselves. And feeling bad about yourself for asking for help is a barrier to getting help. So I think that language answer is just really important. And we're going to touch on all the other answers as we move throughout this. So thank you for that participation. Okay, so Help Wanted, the Help Wanted project is something that I am working on with Elizabeth Letourneau, who is at the Moore Center for the Prevention of Child Sexual Abuse at Johns Hopkins University. We're co-PIs, and we were funded both through the Moore Center and the Reliance organization. Reliance is affiliated with the National Sexual Violence Resource Center. And so we received some funding to develop an online prevention intervention that addresses some of these issues for adolescents who are recognizing a sexual attraction to children. We also, of course, envision this resource to be helpful for their parents and family members, and then for treatment professionals that work with this population as well. So we have the input and expertise from just really fantastic people working in sexual violence prevention and treatment services, and just throughout the country. And so we have Karen Baker from the National Sexual Violence Resource Center, Maya Christopher from ATSA, we have Jared Christie and Gerald Hover and Jill Levinson from Barry University, Karen McCartan, Mike Miner, Dana Rothman, and of course, Jen Tabachnik here in Massachusetts, who's absolutely fantastic. All these people are just really the people you want to work with when you're talking about building something for prevention. So we have in our minds a four-phase style pathway towards developing this prevention intervention. The first project involved qualitative interviews to better get a sense of the needs of youth who are attracted to children. And so we completed 30 interviews with young adults between the ages of 18 to 30 who identify as having a sexual attraction to children. Project 2 is developing the intervention based on the results of those interviews. And it's around really trying to destigmatize asking for help and then providing help. And we have them working through some modules, and so I'll explain all of that in more detail. Projects 3 and 4 are in the future. They're our next steps, and they involve initial evaluation and feasibility study and then randomized control trial. So again, we're sort of matching that public health approach to child sexual abuse prevention, right? So identifying the needs, identifying the potential risk factors, and building a program that's responsive to that, and testing. So I wanted to talk about the results from phase 1. So between September 2015 and July 2016, we conducted qualitative interviews with 30 young adults who were between the ages of 18 and 30. We chose those ages because we wanted to have the recall period be not too great, right? Like, so I'm 34, and sometimes my memories of adolescence are a little fuzzy, right? So we wanted to sort of cap it between 18 and 30 so that the recall period wasn't too long. And then also to make sure that we're talking to people who are sort of the internet age, because a lot of these people go online for help. And so we wanted to capture those experiences as well. As you probably can guess, this is a population that is not easy to contact, right? And so we tried our best to recruit our participants through previous contacts. We've had people call the Moore Center, for help in dealing with their attractions. We partnered with Virtuous Pedophiles, which is an online support group that promotes a no contact message and has users. And so we posted our study materials on that website. We're contacted by interested participants. And then finally, we rounded out our outreach by using our social media account. So we tweeted asking for help with participation in the study. We recorded the interviews. We both called into a anonymous teleconference system, so we didn't know where they were, they didn't know where we were. We recorded the interviews, transcribed them, and analyzed them using Deduce software. Deduce is a qualitative analysis software. So we had 30 participants. After following the interviews, we also directed them to a link to participate in an online survey where we asked about their demographics and some more information about the dynamics of their attraction, stuff that would be easier to fill out online than in conversation. And of the 30 participants, 28 filled out that online survey. So 4 of the respondents who filled out the survey identified themselves as exclusively attracted to children. So it's 14% of the sample, but 4 individuals as exclusively attracted to prepubescent children, whereas the others discussed having a primary attraction to children, but then also an attraction to peers as well, same age peers. The participants were overwhelmingly male and overwhelmingly white and represented mostly from the United States, but then we also had participants from Canada, Brazil, and Australia, and then the Czech Republic in Germany as well. The idea that we have for this resource is that it's not just for American audiences, but we want it to be sort of broad as well. And I'll talk about that in terms of the future steps. Okay, so a few findings from our interviews. The interviews lasted anywhere from an hour to an hour and a half, and we talked about a range of topics. So one of the common elements was that the age of awareness when they started to recognize their attraction was really between the ages of 10 to 14. It wasn't a sudden wake up in the morning and they realized it. It was really a slow realization. They noticed that the actresses or actors that their friends talked about, they sort of had no response to, or that the people that they wanted to hang out with were younger than the people that their friends wanted to hang out with, and started to think like, well, what does that mean, right? What is the meaning behind that? And it was a slow realization. It wasn't like a switch being turned on. Some of our respondents talked about lacking the knowledge, the language, to be able to accurately sort of describe their attraction. They didn't really realize what was happening until they were an older adolescent. Those that did recognize what it was had varied reactions. Some were afraid and felt isolated, and others weren't exactly sure what it all meant for their future. And then there was a large discussion about trying to comprehend or understand their new identity, what this meant for them in terms of their pathway in life. So along that theme, in terms of their responses to having this attraction, many of the respondents talked about social isolation and loneliness, really feeling like they were the only people who were experiencing what they were feeling. Others talked about feeling shame or hopelessness, right? The idea that whenever they heard about someone with an attraction to children, it was someone who had committed sexual violence against a child. So someone who sexually abused a child was being arrested, and that they thought their future was either prison or death. Other participants talked about the need to confront the monster label, the dominant monster label. And the monster label refers to the way we talk about pedophilia in the general public, that these people are monsters, right? And recognizing sort of who they knew themselves to be with how society views them was a part of this acknowledgement process. And then others talked about suicide, that once they realized that they were sexually attracted to children, that they thought that committing suicide was their best option. So I have one quote from a participant here. I'm going to read it for those who are just calling in. It says, this is again about how they responded to having attraction to children. There's nobody to talk to about that for a teenager. You can't tell your parents, you can't tell your teacher, your community. There's just nobody out there. There's no support for them. So highlighting that idea that they really feel isolated and alone when recognizing their attraction. We also talked about disclosure during adolescence. And when we say disclosure, we mean telling someone in their life about their attraction. We asked them, did you tell anyone? How did that go? And for most of our participants, they didn't disclose during adolescence. Some talked about not having, again, the language. They really didn't understand their attraction themselves, so that they weren't ready to talk about it with anyone. Others talked about fear of being thrown out of the house, being isolated by family and friends if they made that admission. Those who did disclose typically did it in late adolescence or young adulthood, and many talked about that they reached a point where they were afraid that they were really just having some mental health distress around keeping this secret, and that they needed to disclose someone for their own mental health and safety. And that they just wanted to sort of receive or maintain acceptance from the person that they were confiding in. So one of our respondents said, quote, actually, the first time I was going to tell my mother I was about to buy a handgun. I was ready to basically die at that point. She didn't take it well. I had a total mental breakdown. I came out to about 20 people that I know through the internet that I had known for 5 or 6 years since I was a teenager, and they took it really, really well and probably saved my life. And that was something that we found frequently, is that in the process of disclosure, many of our respondents sort of practiced online in their online relationships. It allowed them to sort of craft their script or their story to be able to talk about it in person with someone later. We also asked our respondents how they managed their attraction. And it's really interesting, actually. In one of the first interviews that I did, it was either interview 1 or 2, one of the participants, I said, how do you manage your attraction? And how do you manage your attraction to children? And his response was, how do you manage your attraction to adults? And I was sort of struck by that, right? Like, how do you manage your attraction? The assumption is that they're sort of constantly on the edge of offending. And for many of our participants, that just wasn't their issue, wasn't their concern. It wasn't really the risk of committing a sex crime that they felt they needed to manage. They weren't going to do that. They were committed to not doing that. But rather, what they needed to manage was the consequences of the attraction, right? Was the implications of having this attraction and trying to navigate adolescence and young adulthood while being attracted to children. And so that really got us thinking about how we phrase questions, and again, thinking about the importance of language. And so what we did, we sort of switched our approach and said, some individuals with a sexual attraction to children do engage in child sexual abuse. So what do you think are some of the risk factors, or what do you think is necessary to avoid engaging in these behaviors? So we took it off of the respondent and made it more abstract in case that wasn't their own experience. The strategies that they discussed were interesting. Some talked about avoidance of children as important, and others talked about that lack of exposure actually being problematic. That by not being exposed to children in just their day-to-day activities, their day-to-day lives, it made children sort of like a separate sort of object rather than a person. sort of objectify children by keeping them, by avoiding contact with children, day-to-day contact. So they were sort of split in whether avoidance or lack of exposure was a good thing or a bad thing. Others talked about trying to suppress thoughts and ignore the attraction, and using masturbation and pornography and sexual fantasy to deal with the sexual urges. And then a very common theme was just the importance of online communities, talking to people who were like them, to try and manage the implications of their attraction. So in terms of the things that they would want access to, again, with that resource in mind, is really around role models, right? The idea that people who have a sexual attraction to children can live happy, healthy, non-offending lives. Having access to those stories is really important. And also having a properly trained therapists to help them understand their attraction and work through some of those things. A few of our participants mentioned engaging in CBT, and that was helpful. So I have two quotes related to that. The first quote says, "The attractions themselves I wouldn't say are even a problem for me anymore. It's the consequences of them that I have trouble with. Just being 24 and having no real hope romantically while watching all of my close friends and family go through the traditional route of settling down and starting a family at this time in their life. That kind of thing makes me feel really sad and hopeless. I'll never get to really do that. That's something that I need to manage. That's something that I need support to talk about." And then another quote says, "The bottom line is that you can have desires, but you can have other stronger desires. In my case, the most dominant desire was always not to do anything that could harm somebody. It was quite easy to manage too from that perspective." Again, with this theme of identifying risk factors for people who do engage in these behaviors, some of our respondents talked about a lack of empathy as a problem. For people who do engage in these behaviors, that they were never at risk of offending because they didn't want to hurt anybody, but that might not be a value that sort of goes throughout the entire community. Others talked about the problem of social isolation. By not having supports available for individuals with a sexual interest in children, you might drive them towards communities that engage in pro-contact communication. So pro-contact meaning that they support child sexual abuse, engaging in child sexual abuse, that sex feels good, so how could it be harmful kind of arguments. Pro-contact communities, which are actually pretty harmful to adolescents as they're trying to process all of this. Some talked about a lack of understanding that this is harmful to children, that the idea of engaging a child in sexual behavior is a harmful thing. Others talked about the risk associated with just high hormonal and low self-control during adolescence, and again, being mixed views on whether one-on-one time was a risk factor or not. Some saw it as a risk factor, others thought it was important.
Awesome. And we have one question from participants. Did you differentiate at all between survivors of CSA who could be sexually reactive versus those with no abuse history, or did abuse history not matter?
And so we didn't ask about abuse history during our qualitative interviews, but we did have during the online, we referred them to the online survey, and that talked about using the ACEs scale. And so we haven't yet dug into looking at the quantitative data from that and how responses differed, but that's in the next steps. That's a great question though.
Yeah, awesome, thank you so much.
Yeah, thank you for that question. I have two quotes related to, again, the risk factors. I would say that one of the greatest negative factors that I've seen is because the attraction is so, I want to say ostracized, but it's forced underground. It leads people who have the attraction to going and getting into echo chambers with others who feel the same way, which does not lead to healthy points of view or behavior. Then again, talking about those being driven towards pro-contact communities. He goes on, the internet has been particularly harmful like that, forcing minor attracted persons underground and them not having opportunities in the real world to have people understand or help them manage things, means that they do find these underlying communities of others like them, some of whom are not only going to have instructive advice on how to deal with things and will only make things worse for everyone else. We also talked about their experiences with their parents. Sort of, you know, how did they discuss this with their parents? Were their parents a source of support? And what we found is that just like any group of kids, the backgrounds and experiences with parents varied. Many talked about how disclosing their attraction to their parents was important, but it's a challenge. Like, even with the most supportive parents, it would be a challenge to have this kind of conversation. And that support, acceptance, openness, awareness, and sort of non-judgmental communication from parents was really important and helped them feel supported as they sort of were going throughout adolescence. So one of our participants said, I think a parent should bear in mind that the main factor is it's very scary. It's the unspeakable for the child. I'm a very strong person, like I mentioned. Not everybody is in my kind of situation, and it's very scary. For parents, I think they have to reinforce all the time that they're not going to judge them, that they just want the best, that kind of thing. That's all I needed, a calm person to talk to. I need to be massively reassured that they're still there for me, that they're not going to disown me, that kind of thing. I think parents should bear in mind that it's a massive, massive thing that people have probably been hiding for about 2 to 3 years, and they're trying to deal with it. And so we saw different responses from parents. And so one of the individuals that I talked to his mother, and she pulled out the phone book and immediately started looking for some help, some therapy, which was, in the participant's view, like a really sort of affirming thing. Another participant talked about his parents finding his journal, where he talked about some of the dreams, the fantasies that he'd been having. He was essentially kicked out of the house. He was disowned upon discovery of this journal. And so we saw sort of a range of responses from parents. But what they're looking for is to know that they'll still be loved after making this admission. We talked to respondents about the recommendations for therapists. And so what they really wanted was reducing the barriers to therapy. So one, the need for trained therapists and access to therapists. The difficulty is for youth to get therapy without telling their parents why they need it. That posed a challenge to some of our respondents. They talked about issues around cost. Again, how are they going to pay for it, and confidentiality. We had varied responses, very varied experiences with treatment providers based on our respondents' interviews. Some found trained therapists who were essential in sort of navigating adolescence and young adulthood. And others found people who weren't as well trained and who actually put up barriers and said, oh, we can't talk about this. If you tell me about your fantasies, I'm going to have to report you, which is not actually part of mandated reporting, but the assumption was that there was a fear about having that conversation, and so that just sort of shut down that conversation. What the participants were talking about wholly was that they were looking for therapy to be structured around wellness and not crime prevention. And this goes back to that conversation we had about the language. Among this population, there's a concern that people view and interact with them as sex offenders, quote unquote sex offenders, which they're not. They have not yet engaged in child sexual abuse, but they're being treated as sex offenders, and even at the treatment services level. And so what they're looking for is services around affirming their wellness, not necessarily, again, with that crime prevention mind. Because the assumption there is that the sexual abuse is inevitable, it's part of their future, and they have strong reactions to that. So one individual said, thankfully there was a therapist available specifically for, they call it, children and young adults engaged in sexual harmful behavior. That's what the therapeutic intervention was for. It was very specific, so they knew what it was as soon as you walked through the door. They knew that what I was going to tell them. They made it very easy. So this individual talked to someone who treated people who engaged in abusive behaviors and found that though he had not yet engaged in those behaviors, that they were well versed in the subject matter and that they wouldn't be shocked or surprised. And then I mentioned the importance of online communities for this population. Again, they are talking with each other, they're chatting with each other online. That's the sense of community. And they'd like these communities to be accessible and educational. Some of the participants that we talked to sort of bemoaned the lack of good information that's available, but there's a lot of bad information too. Excuse me. But really, it's this idea of needing role models and peer support, people that they can look to help them navigate adolescence, but then also have an image of the future. Again, the idea that you can have an attraction to children, not engage in child sexual abuse, and live a happy and healthy life. So one of our participants said in that regard to online communities, online resources, I've become very involved with them. I've been on there many, many times in situations where I'm feeling a bit upset. It's massively beneficial because there's so many different people on there. We have the core kind of attraction to children, but there's a lot of firsthand advice. That might work for you, this might work for you, that sort of thing. Try it all. That kind of thing is very, very helpful. So in summary of the qualitative interviews, there's a recognition of the attraction in adolescence. And a lot of the participants that we talked to struggled with dealing with that meaning, what that meant for themselves, like that day, and then also for their future. And it's not just about keeping themselves from acting on attraction, though, again, as I mentioned, we do know that people who have a sexual attraction to children can engage in child sexual abuse, and so we can't ignore that outcome either. And that there's a real need for resources for adolescents who are dealing with this problem. And that an online system seems to be the way that's most accessible to this population. So as I mentioned, we took those interviews as the foundation for the remaining project phases. And so what we did was we worked to identify initial areas of focus. We wanted to build an online resource, and we knew that we couldn't cover everything. So what are some of the key areas that we wanted to target? So we came up with 6 initial modules, initial sessions for them to have access to. The first is to provide information about child sexual abuse and why sex with children is harmful. The second is a module that talks about disclosure and safety skills. Again, here we don't advocate, we're not telling them to disclose, because for many youth, I would imagine that's actually not the safe choice. But rather what we're doing here is having them work through a set of considerations, the who, what, why, when, how of telling someone about your attraction, so that they can make the decision whether to disclose or whether to withhold disclosure from a more informed position. Our third module deals with practical advice for self-management and coping techniques, both coping with sexual urges, but then also coping with the negative consequences that go along with having this attraction to children. In a related session, we help them work on building self-identity, so developing that positive narrative. Again, when they go online or when they read comments from on the bottom of the news articles online around people with pedophilia, it's a lot of negative, harmful messages. It's a lot of messages that they should just kill themselves, or they should be, they should be murdered. And so I think it's important for adolescents who are sort of experiencing this to work through developing a positive self-narrative, a positive story about themselves, and that they're not just defined by their attraction, that they're made up of lots of different things. Fifth, we have a module that will be built towards developing skill building for healthy sexuality. And so here a big component in this module will be around issues around consent and developmentally appropriate sexual behavior, that sort of thing. And then the sixth piece is not necessarily a module, it's a resource page. So it links to treatment services, so National Suicide Hotline, other resources to give them access to information in that immediate format. So we, the writers of the resource, are all academics or clinicians. And so we are working with an organization called 3C Institute to help take what we write and actually make it useful for children, useful and engaging and interactive for adolescents. And so 3CI uses a tell me, show me, let me try approach. So there's a didactic instructional video, there's a video interplay and some role play, and then a chance to practice those skills as well. So it's a sort of a 3-pronged approach to convey that information. Tell me, show me, let me try. And we really try and keep each module for about between 10 to 12 minutes, really, because we don't want the users to get bored and click out of it. And as interactive and engaging as possible is important. So in terms of progress on this phase of the project, we have our intended audience and goals in mind. We've developed text for our homepage, and we've developed our outlines for each of the identified modules. We've also drafted full content, so completed content for the sessions for 4 of the modules. So for information about child sexual abuse and why it's harmful, disclosure and safety skills, positive self-identity, and practical advice for self-management, we have the content built for that. 3CI has also created the web content for the first 3. So we're moving along nicely. Excuse me, I apologize for my cough. So I just wanted to show, this is what, in its current form, what the Help Wanted resource will look like. It will have our logo. It will have the Johns Hopkins brand at the bottom. It was really important, based on our interviews with respondents, for any resource to establish legitimacy up front. Like, they wanted to know this came from a reputable source, and so having that Hopkins Moore Center branding is really important. So we talk about the goals of the project, that you're not defined by your attraction, you deserve good health and happiness, and you can keep children safe from being harmed, and you're not alone, right on that front page, so they know exactly what our approach is going to be. And then on this slide, I have an image of typically what the interface will look like, where on the left, they'll have the different modules listed. They can click through it and play. And there's videos, there'll be mindfulness techniques, there's interactives, there's journaling, there's all different styles of engagement for adolescents. And again, we see this as a resource not just for parents, but also for or excuse me, not just for adolescents, but for parents and families of the adolescents as well, the people in that adolescent's life, that they could also go into this website and get some content from it as well. Our hope is, once we've built out this initial phase, to have parent-specific modules and then modules for treatment providers as well. And I talked about this resource being for adolescents, recognizing, again, kind of that comment I made before, that this might include emerging adults as well, that 18 to 25, people who are older than adolescents, but still sort of developing and understanding about their attraction. So that's our future with this project. Our goal, though, is this initial adolescent-focused resource. And so I wanted to talk about the overall philosophy, sort of what we hope to achieve. And so I mentioned that the Moore Center for the Prevention of Child Sexual Abuse, we often get called by parents and by youth and young people looking for help. And so these are all comments that people who have contacted us have said. I hate myself. Could I go to jail just for looking for help? I don't want to hurt anyone. Am I a monster? I wish I was dead. I'm not a bad guy. No one will help me. So some serious messages that these individuals are kind of going through. And so what we hope this resource will do is change the perspective, right? Change the view. So the future looks good, or my attractions don't define me, or I found the help I needed. I've got this. My parents love me. I'm a good person. I will never hurt a child. These are the kinds of messages we want to be hearing from adolescents who are recognizing this attraction. Next steps, we expect to complete the resource by late this summer or early fall of this year, and then move into our evaluation feasibility study, and then a randomized control trial to evaluate the efficacy of the intervention. Again, following that public health model of prevention, really testing to make sure this is a useful intervention. And then if it is, wide dissemination. So in terms of summary points for the talk, the full talk that I've given. Placing children on sex offender registries, again, a dominant response to youth who engage in problem sexual behavior, is costly, it's ineffective, and it's also harmful, right? So this is not the approach that we should be taking. A public health approach, one that addresses child sexual abuse before it occurs, is much more promising. And so to do this, how do we instill sort of like an agenda towards child sexual abuse prevention? To develop that agenda, we have to increase accountability, right? Like within government agencies and within our communities, who are the people that are going to take the charge to promote child sexual abuse prevention? How do we promote research, right? Data-driven, evidence-based interventions. This is, we should be putting our resources towards things that work. But to do that, we have to fund the science, right? We have to fund the science and advance the science to be able to test these things. And the vast majority of our current funding goes towards after-the-fact responses. And so we have to kind of shift that focus. By doing this, this increases the knowledge base, increases the things that we know work, and lets us identify those things that are ineffective, right? And another important part of this is thinking about the way we communicate, right? Confronting that monster narrative. And, and hearing the respondents talk about, themselves confronting like that monster label, you got me thinking about monsters. Well, who fights monsters, right? Like superheroes, Harry Potter, right? Like it almost, by using a monster label, it makes the problem seem insurmountable. It's like, no, we as adults in this community can actually take this charge. And then to really, when we're talking about prevention, really focus on primary prevention, preventing harm before it occurs, right? This is where the thing that we need to prioritize. And so the way we talk about child sexual abuse as something that is preventable, I think is important. So to develop doing this work, I refused to tell people what my job was. Like with the stuff that I did, I just told people I was in insurance, right? My dad's in insurance, and no one ever asked him about his job. I say what I did. I studied sex offender policy, and I would either be yelled at or be told, oh, these people should just be murdered, or there's nothing we can do. Now, I actually engage in the conversation, but I do it differently. I say I work in child sexual abuse prevention. And from that model, from that start point, we can actually have a conversation. Oh, prevention. Well, how would you prevent child sexual abuse? Oh, here's how you would prevent it. And it engages people in a conversation in a different way than, oh, I study and evaluate sex offenders, right? That starts a different conversation. So these goals are achievable. And so in conclusion, as you think about this talk and in the future, I would just ask you to think about how you in your own work and lives can promote a public health response to child sexual abuse. So thank you.
Thank you so much, Ryan, for sharing all of your knowledge.
Thank you.
And so now we have time for questions. If anybody else has any questions, you can feel free to write them in the chat box. We got a question saying, will your slides be available for us to print out too? Yes, we'll be sending them out after this as a PDF, so folks will be able to access it that way. But while folks are typing in any other questions that they may have, I am going to put a survey out, and if folks can please fill this out, it's inside of your chat box. That'll help us be able to better cater to the needs of our membership for later on programming. Yeah.
Absolutely.
Yeah, but thank you so much, Brian. This was great.
Thank you. Thank you for having me. I'm so excited to be here and be able to talk to your organization, and I really appreciate it.
Yeah, thank you so much. And so I don't see any questions so far, but we'll wait a couple more minutes to see. And then
if I can, I also have my contact information.
Oh, awesome. Perfect.
So if you think of a question on your drive home from work, feel free, you can send me an email. I'm also on Twitter at Ryan_T_Shields. So feel free to reach out to me. I'd be happy to answer any questions either now or in the future.
Awesome. And so we do have one question.
Okay.
It says, how do you balance talking about adolescent sexual attraction to children when the sexual violence field focuses the discussion on power and control, making a clear distinction that SB is not about sex and attraction?
Right. And I think that's one of the difficulties in having these conversations, because absolutely you can't remove the power and control part of this. It's not just about attraction. I think our focus is on behavior and the difference between attraction and behavior. Mm-hmm. And so the behavior, there's power dynamics and control dynamics are around, structured behavior. And around the attraction, the research suggests that attraction to children is sort of neurological in its origins. So we want people to make the distinction between an attraction and then actually the behavior. The behavior is, I think, the important part there. And thinking back to those risk factors, again, thinking of the social ecological hierarchy, right? So it's individuals within relationships and communities, and then in society, and how those power structures dictate all the other lower levels. So it's absolutely part of the conversation. I think in our work, we focus on the distinction between attraction and behavior.
Awesome, thank you.
That's a great question.
Yeah, definitely. If nobody else has any other questions, then we'll be closing up pretty soon. But as Ryan offered, he's always available to answer questions via email. He's also on Twitter, so follow him. But yes, thank you so much for all this information. It was really enlightening for me. So
thank you everyone for attending. I really do appreciate it.
Awesome. Thanks everyone. Bye.
Did that go? Close it. You're still on.